Hello, everyone. Dr. Jack Wolfson, board certified cardiologist. Welcome to my presentation that is obviously very important. It's called Advanced Cardiovascular Testing. I'm going to tell you all about it. Again, I'm Dr. Jack Wolfson, board certified cardiologist at Natural Heart Doctor. Now, cardiovascular disease is the #1 killer in the world. It is above cancer and everything else. It is the #1 killer in the world, despite, again, all the trillions that are paid in pharmaceuticals and in procedures. Millions are suffering from heart attacks, millions are suffering from strokes, millions suffer from atrial fibrillation, congestive heart failure, high blood pressure, and really all these different cardiovascular diagnoses. And you're probably one of those people, which is why you're watching this video, or maybe someone that you love has this particular condition. Now, again, I'm not about the pharmaceuticals. I'm not about the procedures. There's a time and a place for those, but they're really at the end of what we do. We provide really a multi-pronged strategy: eat well, live well, think well. And that is the foundation of what we do. But again, what we really want to focus on for the purpose of this presentation is test, don't guess. We want to tell you about the most advanced cardiovascular testing in the world. And again, by using that information, we can really do a deep dive into where you're at. So tonight's presentation is going to be about not the 1970s tests, not about the tests that when my father started off as a cardiologist, these were the tests available. Unfortunately, these are the same blood tests that are still used by most cardiologists today. And I'm going to tell you one of the tests that I use that is the most advanced cardiovascular test available. Now, again, a little bit about me. I was the senior partner in the largest cardiovascular group in the state of Arizona, director of cardiology, medicine, and rehab. I was voted by my peers in 2011 as one of Phoenix top doctors, top 50 functional medicine doctor worldwide, 5 times top holistic MD, widely traveled international speaker and author, and the founder of naturalheartdoctor.com. Here's a couple of books that I've appeared in. On the left is the textbook of integrative cardiovascular medicine, of which I have a chapter in. And then we've got my personal book, The Paleocardiologist, The Natural Way to Heart Health, which I know so many of you do have. So these are some of the advanced tests that we do in our office, where we look at advanced cardiovascular panels. We'll talk about that in this presentation. The micronutrient test, looking at intracellular vitamins and minerals, glutathione, CoQ10, omega-3s. We look at leaky gut, wheat, gluten sensitivity. The triple toxin test, the mold, the metals, and the environmental toxins. Then we do gastrointestinal testing, GI effects, and IBS sure to see if you've got something called SIBO, or small intestinal bowel overgrowth, tick-borne illnesses, Borrelia, Lyme, Bartonella, Babesia, and more. Neural testing, antibodies, neurotransmitters, organic acids. We do so many fantastic tests. But again, I want you to see the smattering of what we do in office, what we offer online as well. But I want to talk now about advanced cardiovascular testing. So give me some time, because I want to tell you what is exactly on this panel. And on this panel, these are all the different things that we look at when we really want to do a deep dive into what's going on with you. This is typically more important than any stress test, more important certainly than a CT scan. It's more important than the 1970s blood work. This is very advanced blood work that I think, again, you are going to love. So let's start right now. Let's talk about part 1, where we talk about cholesterol, lipid particle numbers, triglycerides, Lp(a). This presentation, we're going to teach you about what these lab parameters are, why they're important, and then in subsequent videos, we will break it down and talk about what to do with these individual things. And these will be much shorter videos. Again, we'll talk about what the problem is, for example, with Lp(a), and then we'll talk about what to do about it. Now, the Advanced Cardiovascular Testing Panel starts off with that 1970s test, where again, we're looking at total cholesterol, total LDL, total HDL, triglycerides. What really matters, though, is, as you see on the screen, the second piece of the puzzle right there, ApoA-1, ApoB, and then the ratio of ApoB to ApoA1. And you can see on the right-hand side, we've got previous. On the left, we had the current test results for this individual person, and we improved dramatically on every parameter. And I'd like to think that when you follow what we say at Natural Heart Doctor, when you follow Mother Nature, when you follow common sense health and wellness practices, you get the best results. And then you dial in evidence-based supplements that supplement that particular lifestyle. Now, I do want to talk to you and tell you cholesterol is nothing that's magical. Cholesterol is certainly magical, but it's only three things: carbon, hydrogen, oxygen. There's no mercury, there's no cadmium, there's no toxic things that are in there. It is just these three things. And cholesterol, as I've talked about in chapter 1 of my book, is a very important molecule that no animal species can live without. We need cholesterol for so many different things. Our hormones come from cholesterol. Our vitamin D comes from cholesterol. Our digestion comes from cholesterol. In fact, every cell membrane contains cholesterol, and so the cell membrane is the fence around the cells, and the cell membrane keeps things inside the cell that belong, keeps things outside the cell that don't belong. And you can see on the slide right there that in lime green, those are molecules of cholesterol. So you can see how important they are for the cell membrane. But the majority of that cell membrane, FYI, those yellow balls, those are essentially fish oil. Those are fish oil, and that's why we're huge fans of eating seafood. Okay, so total cholesterol is actually a poor predictor of cardiovascular health. You can see on the slides right there that the total cholesterol really, and I know this is a busy slide, but this is from the 1970s, where we could say that out of 350,000 men in this particular case, the sweet spot as far as living or dying was a total cholesterol 160 to 260. Above 260, we had increased of dying. Below 160, we had an increased risk of dying. So again, it's not a very good test, especially between 160 and 260, in order to be able to help us. We need better information. And in fact, Dr. Michael DeBakey, the most famous cardiovascular surgeon in the world, Michael DeBakey, who is now since passed, when he looked at this back in the 80s, he said an analysis of cholesterol values in 1,700 patients basically said cholesterol has nothing to do with coronary artery disease per their studies that they were doing. So if we look at things that are important, we want to look at LDL particles, HDL particles. Again, HDL is considered the good and LDL the bad. That is pure pharmaceutical company speak. We can't live without LDLs. We can't live without HDLs. And we want optimal functioning of both, and we can actually test for that. And here's a test from 1979, a study from 1979. And even they knew this over 40 years ago. Are apolipoproteins better discriminators than lipids, cholesterol, for atherosclerosis? They knew this over 40 years ago, and it's true now. This is actually from Dr. Salim Youssef. This is from the early 2000s, where essentially the higher the ratio, ApoB, ApoA1, the higher the heart attack risk. Therefore, the lower the ratio, the lower the heart attack risk. And you can see where they got down to 0.43 on the bottom left-hand corner. So again, the lower the ApoB, ApoA ratio, the lower your risk. Have you ever had that tested? Has your doctor ever tested that for you? So again, we do have a handout that goes with this video. We can certainly get you that handout. We'll include that in an email with this video as well. So stay tuned for that. So we want to know these particular things, and with that handout, you can take it to your doctor and say, hey, I want all these tests, and then you can come back to us for watching our videos, or we'll have the opportunity also in the email that's attached to this video. If you do get this in email format, we will we'll be able to, again, make sure that we set you up with testing on our side as we do for people all over the world. Now, here's from 2011 the Journal of Biomedical Research. ApoB, ApoA1 ratio is an effective predictor of coronary heart disease risk in overweight people and obesity. So again, what was proven in 2004 is proven again. And again, apolipoproteins, this talks about stroke risk. So people who have had a stroke, we want to take a look at that. Actually, a high ratio is linked to triple the stroke risk. Triglycerides are another very important marker, a 1970s marker, if you will, but I find them very pertinent today. And again, the higher your triglycerides go, the higher your risk of cardiovascular disease. So we want to make sure, again, we get those triglycerides as low as possible. In other videos, we'll talk about how we do that. But again, if you follow the principles of eat well, live well, think well, and you do evidence-based supplements to supplement the eat well, live well, think well hypothesis plan, then you will get good looking triglycerides. Now, another marker you want to know about, ask your doctor or ask us, LP parentheses little a. A lot of doctors do not even test for it, even cardiologists, but it's responsible for a large percentage of heart attacks. This was kind of made famous by Bob Harper from America's Biggest Loser. He looked like Iron Man on the outside. On the inside, unfortunately, he had a lot of coronary artery disease. There may be multiple factors for that, but one thing that he has made a big deal out of in promoting, and of course sponsored by pharmaceutical companies, is that, again, he's got this particular problem, this LP little a. And here we look at, actually from the Copenhagen City Heart Study, that when you have very high levels of LP little a, 3 to 4 times the increased risk of heart attack. So we want to know that and want to do something about it. LP little a is associated with high blood pressure. So if you have high blood pressure, you want to know if you have this. Everybody should know if they have this, especially if they have family members with some kind of cardiovascular issue below the age of 60. Now, this is an example of some of the testing we do, where again, we look at that ratio. In this particular case, the before is on the right, the after is on the left, and we can see how we went from an ApoB, ApoA1 ratio of 1 down to 0.78. And you can also see that we tested LP little a, and it was high in this particular case. Now, if we look at more markers now, I want to tell you about the markers of inflammation, because inflammation is so critical. Inflammation is your body on fire. Inflammation, when we measure it, is a sign that you're irritated, you're inflamed, there's a problem going on with you, and we need to figure out why. And inflammation is actually a much bigger risk factor than actually lipids are. When you have inflammation, we've got to figure out why, because again, inflammation leads to all kinds of heart problems. 3 times the risk of heart attack in this particular, this is from New England Journal of Medicine over 20 years ago. And a lot of doctors are still not checking for this particular marker. So again, 3 times the risk of heart attack. Inflammation is linked to blood pressure. Inflammation is linked to stroke. Inflammation is linked to everything cardiovascular-wise, most certainly. And again, it's linked to dementia, Alzheimer's disease, it's linked to cancer, it's linked to people dying young. So we want to make sure that we check you for markers of inflammation and work with you to fix those. Eat well, live well, think well, evidence-based supplements. This is a particular lab test that we did on this person. Over on the right are the old, on the left are the updated versions, and you can see that all the parameters improved. The HSCRP went from 2.7 all the way down to 0.8. That's certainly a good move. And then even oxidized LDL, that we'll talk about in a second, that also improved. And here, actually, oxidized LDL is a marker of damaged LDL particles or oxidized LDL particles. Again, LDLs are good. They serve a very important purpose, but what they're linked to is when there's oxidized, when they're damaged, and you need to be tested for this, double the heart attack risk. So we got to check that out. Please check that out. Another marker of inflammation called MPO or myeloperoxidase. Myeloperoxidase does some things, including turns LDL into its oxidized or damaged form. It can actually cause dysfunctional HDL. It leads to dysfunctional endothelium, or the lining of the blood vessels. And then ultimately we can have high blood pressure. We can have issues with erectile function. And then in addition, myeloperoxidase promotes a vulnerable plaque state, which can lead to heart attack. So again, you want to know your MPO. Now, the phospholipase marker is really one of these more exotic markers, but it's very important. And again, most doctors are not testing for it. This is a busy slide. You can stop and take a look at how it all happens. But essentially, phospholipase A2 is sitting inside of arteries and grabbing onto these oxidized LDL particles and converting them to even more damaged downstream molecules of what that is. And again, that just leads to more plaque formation, unstable plaque, plaque rupture, heart attack, and widows and widowers, if you will. And again, here we saw this in 2010, where we see this PLA2 as a novel risk marker for cardiovascular disease. Again, so we've been using this for years. And here's an example again of these markers of inflammation: PLAC that we just talked about, HSCRP, OXLDL, MPO. Also included on this slide is homocysteine. And in this particular case, this person's level is 14. And again, what we love to do is to be able to take people like, in an example, here you can see this most recent patient of mine where, again, his HSCRP, let's focus on these markers of inflammation, started off at 2.5. And then on the right bottom, it goes to 1.2, and most recently it's 1. If we look at things like MPO, we were at over 2,000, and then we went to 1,100, and then we went to 916. So we're really making dramatic improvements. Now, while we're here, you can also take a look how we went from a homocysteine of 14 down to 8, down to 7. So let's go ahead and let's talk about homocysteine. Homocysteine is an important molecule, but we don't want too much and we don't want too little. So what happens is that when we have this elevated homocysteine, it leads to platelets being sticky. It leads to blood vessels not working very well. It leads to smooth muscles coming into the blood vessels to lead to disease, and it leads to dysfunctional lipids. So, and ultimately those all wind up with cardiovascular disease. So we want to check our homocysteine levels. And again, so many people don't have a check. Homocysteine 18 and above, 2.5 times heart attack risk. We got to know and we got to fix it. That's from 1999. Here we can see actually that if your homocysteine was below 9 in a 4-year period, less than 4% of people died in this particular trial. If you look at people with homocysteine above 15, okay, 15 and above, excuse me, a quarter, 25% of those people died. So again, if you have coronary artery disease, or even if you don't, we want to know about your levels of homocysteine, and then we can start to fix those. Homocysteine leads to a higher, triple the risk of high blood pressure. Another marker that we check out is called heart stress. And again, when the heart is under stress from high blood pressure, from leaky heart valves, it releases this hormone called BNP. And blood pressure is just a number. But what is that number doing to your heart? Well, that's where BNP can come in. And again, we can take a look at BNP. The body produces it because it's trying to unload itself. It's trying to cause you to urinate, trying to get the fluid off of you. But oftentimes, again, it's not enough, and these people wind up in congestive heart failure. So again, we want to check the BNP as a great place to start. And here, for example, BNP over 1,000, and this particular person, we marched them down from over 1,000 On the second check, it was 732. On the next check was 463. So we're moving in the correct direction. More markers that we test, don't guess. Let's look at insulin, fasting glucose, hemoglobin A1C. Now, what we see here is that when we check fasting insulin, and insulin is a very important hormone for control of glucose, blood sugar, for control of protein and fat metabolism. It's a very important molecule. And what we know essentially is that the higher your insulin levels, the worse off you are. So again, this is from 1980. High plasma levels linked to heart attack and coronary artery disease. 1991, high insulin levels, predictor of heart disease deaths and mortality. And then ultimately also high insulin and increased risk of cancer as well. So again, high insulin is not a good thing. What is your fasting insulin level? Do you know? You should. Fasting insulin is linked to high blood pressure. Check your fasting insulin. In addition, elevated blood sugar over a longer period of time leads to elevated glycated hemoglobin, otherwise known as hemoglobin A1C. And the A1C is a 3-month average of blood sugar control. We need to know your number. The higher the number, the higher your risk, heart attack, stroke, being dead, you name it. We can get into thyroid testing, which we do. And this is an advanced thyroid panel. So we're looking at TSH, but we're looking at total T3, free T3, total T4, free T4, and then also the thyroid antibodies, anti-TPO, anti-thyroglobulin that go along with Hashimoto's or autoimmune thyroid disease. And also we check reverse T3. So for people with blood pressure issues, what is your thyroid function? Because again, it means something for us to check that out. Now, this is a very busy slide. Again, hypothyroid and your heart. When your thyroid is underactive, bad things happen. You can look at the chart, what it does as far as heart failure, shortness of breath, lipid abnormalities, inflammation, heart rhythm problems, blood vessel problems. The way the genetics of the heart work are suboptimal. They're not good when you have underactive thyroid. And again, ultimately, these things lead to heart attack, stroke, and your chances of dying young. When we check those thyroid antibodies, again, we see this in the pregnant model, where again, these women who had thyroid antibodies had a higher risk of pregnancy hypertension. I think it's safe to say that also relates to adults who are not pregnant. And then also, as we look at people with autonomic dysfunction, people with this sympathetic, parasympathetic tone out of balance, leading to blood pressure issues, heart rate issues, lightheadedness, dizziness, heart rhythm issues as well. So cardiac autonomic dysfunction, and we see this with anti-thyroid peroxidase antibodies as well. So advanced cardiovascular testing, let's dive into vitamin D and uric acid. Vitamin D lowers AFib. I mean, you know all this about vitamin D already. Again, lowers AFib risk, lowers heart attack risk, lowers stroke risk. It's anti-inflammatory, antioxidant, lowers risk of high blood pressure, improves endothelial function, improves lipids, and lowers smooth muscle proliferation. And all those things are all just phenomenal for what vitamin D does. Every single cell has receptors for vitamin D. We need to pay attention to it, just like we need to pay attention to uric acid. So what are your levels of uric acid? Uric acid is an important molecule, but again, we don't want it too low, and we certainly don't want it too high. Uric acid above 8 equals much higher heart attack and stroke risk. So do you know your uric acid level? And if so, if it's high, what is your plan to reduce it? We talk a lot about those plans inside of other videos. And of course, when you work with myself, other doctors at Natural Heart Doctor, or some of our health coaches. High uric acid, 2.75 times higher AFib risk. So if you've got atrial fibrillation, what is your uric acid? How do we improve it? High uric acid is linked to arterial stiffness, and therefore, blood pressure issues and heart issues. Uric acid, again, causes high blood pressure in animal studies. So we want to really take a good, this is 1966 data. It's a problem, high uric acid, and a lot of doctors are finally starting to address it. And in this particular patient, again, the old test showed a uric acid level of 7.5, and then in the lower right down to 5.8, and then the current is 5.2. So fantastic stuff with this patient's uric acid levels. No pharmaceuticals, eat well, live well, think well, evidence-based supplements. We did it. And now we're coming towards the end here in a kind of rapid fire presentation. CBC, iron and ferritin, CMP, these are 1970s tests, but they provide a lot of good value to you as well. Here we can see that when your white blood cell count, also known as leukocytes, when your leukocytes are above 9,000, 4 times the heart attack risk, 4 times the heart attack risk than someone whose white count is below 6,000. So we want to just look at that simple marker. Hemoglobin is, again, very important, and we love people to have hemoglobin, which is the oxygen carrying molecule inside of red blood cells. This chart looks at atrial fibrillation along with hemoglobin, and what it tells us on the left are the men, and the sweet spot for hemoglobin in men, 13 to 15, and the sweet spot in women, 12 to 14. So that's where we want our men and our women to wind up as it pertains to atrial fibrillation, and I think everything else. Hemoglobin is linked, when hemoglobin's high, so is blood pressure very typically. Another marker from the 1970s, red cell distribution with RDW. The higher the RDW, the higher the heart attack risk. MCV, mean corpuscular volume above 95. 25% higher cardiovascular disease risk. Now, again, I don't want you to get nervous about this. You can stop the video. If you have old blood work, you can take a look and see where you fall at on these. But again, my team knows all these factors. I know all these factors because I created this presentation. And ultimately, again, if you want us to help you with this, we are here to help. All you got to do is just set up a call and we'll help you lower your risk. The 100-year heart, that's our goal here, right? Platelet count, what is your platelet count? Above 400 equals 50% higher risk. So we got to take a look at that. The platelet size, the size of the platelet matters as well. And this is from 2011, and more data show the same. Again, this mean platelet volume, the higher it is, the higher your risk of heart attack and other things. Now, if we look at high iron levels, we love to check iron and ferritin. In this particular study, again, ferritin, when it's elevated, increased risk for cardiovascular events. It leads to aortic stiffness and high blood pressure. We see that correlation as well. As an aside, I love donating blood. I think donating blood or therapeutic phlebotomy is a great strategy for health. Here's the comprehensive metabolic panel with, again, sodium, potassium, glucose, kidney function, liver function tests are on there. It's a good old time test that does provide some value, so we certainly utilize that. Getting into the hormones, we check these different hormones: total testosterone, free testosterone, estradiol, DHEA, progesterone. We test these things, and again, when your testosterone levels are high, so is your blood pressure, especially when you use hormone replacement. It has to be done the right way, has to be monitored the right way. I've seen so many people run into problems from hormone therapy. The practitioner, not only must they know what they're doing, they have to pay attention to how the hormones affect you with very close attention. Testosterone converts to estradiol, and when estradiol is high, so is your stroke risk. We don't want that. And finally, cortisol and hypertension. Again, what is your serum cortisol for all of you, but especially the hypertensives? So that was a rapid breakdown of all these things on the Advanced Cardiovascular Panel. And I certainly welcome your comments, your emails about these particular tests. I'm going to start to go a little bit more in depth about each one, and then also come up with treatment strategies for you and put those into videos from us at Natural Heart Doctor, the Advanced Cardiovascular Testing. So again, when you order from us, we do it virtually, you order from us, we find you a local lab, then we check the blood and urine if you do additional testing. It takes a few weeks to get the results back. You receive all the test results, we receive the test results, and then you can choose to either have a free coaching call to go over the results, or you can have a call with myself or one of the other practitioners at Natural Heart Doctor. And as much as we like to look at the advanced cardiac panel, we also do what we call level 2 testing in this particular scenario that I recommend for everybody, where it's the advanced cardiac, the micronutrient test, looking at intracellular vitamins and minerals, looking at CoQ10, glutathione, looking at other proteins and amino acids, looking for omega-3s, very important stuff. The next test is the wheat zoomer that looks for leaky gut and gluten sensitivity, wheat sensitivity. The mold mycotoxin test, testing you for over 30 different mold mycotoxins that lead to so much disease. Then we test you for over 20 different metals, and we also test you for over 40 different environmental toxins, from plastics to pesticides, to phthalates and parabens and VOCs and all kinds of nasty stuff. So again, if you watch this video, you can get the, if you use the code PREVENT, at the link provided in the email over at Natural Heart Doctor, when you order level 2 testing, use the code PREVENT and you will get 10% off of this test, but it's only good for the next few days. So this is all the information that again, that you need. If you want to get it tested with your local doctor, see if they run some of these tests. Chances are they don't. My suggestion to you is level 2 testing. Use the code PREVENT for a 10% discount. We'll put that all into the email for you. And then again, you can go over the results with one of the coaches at Natural Heart Doctor or one of the doctors, myself or Dr. Lauren Latanza. So again, I appreciate this for you. We're also going to, again, we'll put this into a PDF for you, that document. And again, now you'll have this document to be able to help you move forward to make the best decision with your health, whether you're working with us or you're working with your local doctor. So Dr. Jack Wolfson, Natural Heart Doctor, your home for the 100-year heart. I am signing off. And again, I appreciate all of you, and we will see you in the next video.